Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Mark Ishaug, President and CEO of Thresholds. Thresholds provides healthcare, housing, and hope for thousands of persons with mental health and substance use conditions in Illinois each year. Mark, how are you?
I'm good. Thank you for having me this morning.
Oh, my pleasure. Happy that you're able to join us. I mentioned that I spoke with Emily, one of your colleagues, Threshold colleagues, in our pre-production call, and she was singing your praises to such an extent I became a little bit uncomfortable. These conversations don't usually have any kind of adversarial aspect to them, but I may have to make an exception, Mark. I may have to take you down a couple of pegs.
Please do. But do not say peck. Do not say a couple of pecks, because there is a woodpecker outside of my office window right now. And
oh my goodness.
Yes, right. I am really being challenged by a woodpecker right now. So for you to say, bring me down a peck. Any you can do anything, but don't say the word peck.
I'll bring you down a couple of pegs, but no pecks.
Okay.
Is that a deal?
There you go. It's a deal.
Kind of split dips. Anyway, Mark, really, I do appreciate it. I was really looking forward to having this conversation, having spoken to Emily. So you've been president and CEO of Thresholds for close to 14 years. What did you do before Thresholds, and what led you to this line of work?
Oh, well, my goodness. So I've been in nonprofit work, leadership, management for the last 40 years. So I graduated from Notre Dame 40 years ago, 1985, and sort of began my journey in nonprofits. I went out, I was what was called a Holy Cross Associate Volunteer. It was a volunteer program through the University of Notre Dame, and I was assigned to Colorado Springs, Colorado, where I worked at the Pikes Peak Justice and Peace Commission. After that, I worked in New York for the Africa America Institute. I spent time in Africa and Zimbabwe and Mozambique and Kenya. And but it was about 35 years ago after I finished graduate school up at Northwestern in 1991, and I started my first nonprofit job in Chicago in April of 91 at the AIDS Foundation of Chicago, where I was for 20 years. And we were the leading local organization in Chicago, fighting the good fight against HIV, doing all things HIV prevention, care, housing, and advocacy, most importantly. And so I did that for 20 years. I did a short stint in Washington, D.C. for AIDS United. And then I joined Thresholds almost 14 years ago as the president and CEO. And so I've been on a wonderful, wild, exciting, important journey for the last 40 years. And 62 years if you count my whole life. So there you go.
Excellent, Mark. I really do. I appreciate that. That's a pretty amazing career. And, it seems as though there is a one through line in the work you do. A lot of people go into different lines of work and, they wake up 3 a.m. and wondering what they've been doing with their life. I suspect that, we all have that conversation, but you may have that or grapple with that a little bit less than most people do. That's a question. Or maybe it's a rhetorical question. I'm
there
not
you
sure.
Go.
Maybe it's just a statement.
So, I've been just really so lucky and so blessed my entire life. I grew up in a household on the south side of Chicago filled with lots of love and laughter and parents and grandparents who adored me, which is very helpful. We didn't have a lot of money in the house, but we had a lot of love. And it really sort of set me, I think, on the path that I'm still on today. I talk about leading with love at Thresholds all the time. I've given talks all around the country about this.
I want to get back to that. I don't want you to get out in front of me on that.
Okay,
I want to devote a portion of our conversation to that. That's an important part of what I want to talk about.
Awesome.
So, now that we're actually going a little bit down memory lane, what's the one thing you wish you knew then that you know now?
Wow. Wish I knew then what I know now. So it's such a great question, and I should have been prepared for this. I love music. I have no musical talent. I can't sing. I can't dance, but man, do I love music. And, there's so many musicians that inspire me, but there's one particular song that I've been thinking about a lot this year by an artist named Mary Chapin Carpenter. And it's on the very last song of her new album. And I don't know exactly how it goes, and I won't sing it for you all, but the last lines of the song called Coda was the name of the song, Coda, Coda. She says that after life's big acts and its interludes are quiet mornings of coffee and gratitude, and a coda without words, and the poetry of birds, and the brave and shining hearts you matter to. So I think about that a lot now. And I also think about one of my favorite songs way before I was born called Nature Boy. I'm a nature lover. I'm a nature boy.
Of course.
I'm out in the woods. We live right off the forest preserve. So nature is a huge part of who I am. But in that song, you know the song, there was a boy, a very strange, enchanted boy. And this is what he said to me, that the greatest thing you'll ever learn is just to love and to be loved in return. So,
Yeah.
so that's what's really important to me. And when I think back on what I wish I always thought about when I was, even so much younger, is just that, like, the only important thing in life is to love as much as you can and to be loved and to allow yourself to be loved, and the brave and shining hearts that you mattered to. Because I think at the
Yeah.
end of the day, that's what it all comes down to.
Yeah. Well stated. By the way, there's a new terrific biography on Nat King Cole, which I highly recommend. Just so
Okay.
you know.
I just got yesterday the brand new Patti Smith book. I read her book years ago called New Kids. Are you pointing at a picture of Patti Smith?
I am pointing at not just a picture, but the iconic picture wearing her Keith Richards shirt.
That is iconic. Yeah. So,
That is iconic. Back to the horses days.
oh my gosh. Yeah. A classic. So, yeah, I got as a gift yesterday the new book. I can't remember the title, but I have it right over here on my table, and I cannot wait to dive into it.
Yeah. Okay. So we're not even 5, 6 minutes into this, and we discovered two musical artists that we both love. So this is shaping up to be a very good
Awesome.
conversation.
Well, and if you don't know Mary Chapin Carpenter, I'm a proselytizer when it comes to her. So there you go.
All right. No. All right. Excellent. Excellent.
Check out her 35, almost 40-year discography.
For sure. For sure. We could probably have a whole other conversation just focused on music. Might
There
have to
you
do
go.
that.
I'm up for that.
So tell us about Threshold, your mission, what you've accomplished as an organization that you're most proud of in these past 14 years.
So Thresholds was founded in 1959. So we go back, we're approaching 70 years. And we were founded just before, a couple of years before President Kennedy, JFK, signed into law in 1963, just a couple of weeks before his assassination, the Community Mental Health Act, which was designed to move people out of institutions, to begin to close what were called insane asylums, where people were warehoused forever and ever by the hundreds of thousands. And we were founded just around the time of this deinstitutionalization movement, originally as a clubhouse. It's just a very specific term that the mental health community adopted years ago for people who were coming out of institutions with no place to go, to have membership somewhere. People with serious mental illness deserved a club or a place to go. And that's how Thresholds was founded, based on a really spectacular organization in New York City called Fountain House. I think our original director came from Fountain House in New York City. And we've grown tremendously over the years, as you can imagine. When I started at Thresholds 14 years ago, we were about a $50 million organization and 600 people. And today we're about a $135 million organization with close to 1,400 people, serving almost 13,000 people a year, only in greater Chicago. We're in Chicago and what are called the collar counties, really northern Illinois, from McHenry County to the north, Kankakee County to the southwest, and then down to Blue Island and DuPage County and a lot of places in between. Our tagline, you mentioned it at the top of the show, is home, health, and hope. And I always say it always starts with housing. So because without a decent place to live and supportive services, it's really hard to be healthy and to have the hope that you need to be on your mental health recovery and discovery journey. So we provide housing. We own about 700 units and we manage about 1,600 units. So we're a big, if not the biggest, supportive housing provider in Chicago, certainly one of the biggest. We provide a variety of health care, psychiatric care principally. But years ago, we were in a, what's the good word for this? Not the instigator, but we were an early adopter of what is called integrated behavioral health care,
Mhm.
where mental health care, psychological care, and physical health care, primary health care, are deeply interconnected, often integrated and often co-located, like one of our partners is co-located at a threshold site. So thousands of our clients today, or members as we call them, have access to high quality primary care that just a decade, 2 decades ago, people with mental illness did not have that, which is why so many people with serious mental illness died so much earlier, in some cases 25 years earlier than people without serious mental illness, not just because of the mental health challenges, but because of the lack of access to decent quality primary care. So we've changed that story, and we have 4 integrated partners now with thresholds that I'm so proud of. So that's a huge, huge part of what we do, and a huge reason for our success.
Yeah, you actually, again, are a little bit out in front of me because I
Oh,
did want to talk to you. No, 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 that's good. I did want to bring up integrative care because I know it's fundamental to what you do. Is there any great, inspiring success story that you can share that goes to the heart of what you guys do so people could hear this and say, ah,
oh yeah. I mean, we help people fulfill their hopes and their dreams by helping them find the housing that they need and deserve, by then getting them connected to primary care and psychiatric care, by getting them and helping them maintain a job that they want. We have one of the biggest supported employment programs in the country for people with serious mental illness. And we don't have sheltered workshops. We don't have someplace where people come and work and put together widgets at a threshold's own place. We help people find a job where they want. Panera, McDonald's, the Botanic Gardens, Old Navy, you name it, CPS, Chicago Public Schools. And that's a really exciting part of what we do, because we know that meaningful employment and engagement in life is one of the best predictors of mental health recovery possible. We just bought a new 100-room SRO, single room occupancy hotel, that would have been lost to the private market and gentrified and made upscale. And we pulled together in a couple of weeks a whole group of funders and worked with the city of Chicago and the owner of this building to save this building. We're on the CTA, the Chicago Transit Authority, helping people who are using the CTA as housing get the health care and housing that they need. On the streets where people are living because they have no place to go, the same thing. Reaching out to folks, making a relationship with them, and helping them get to the place they need to be. But that's one of the things I'm so proud of, Charles, is that, and it gets back to my earlier comment about deinstitutionalization. Over the last 14 years, we have moved nearly 1,700 people, men and women, out of nursing homes and out of what used to be called institutes of mental disease, or now called SMRFs, specialized mental health rehab facilities, and places where people have lived for a long, long time, but they were not the right setting for people to be integrated into the community and to really begin a journey, a life journey outside of an institutional setting. And the fact that we have moved almost 1,700 people to the community, provided them with housing, provided them with all the tools they need to thrive, survive, live the lives they want. I mean, it's so, so exciting. And that's just one example of a program that just fills my heart with so much joy and gratitude that we can help people live in the community and get a job that they want.
amazing work. Is there any, or are there any common misconceptions when you talk to people who are outside this space that they have about your work?
Yeah, I mean, that's a great question. I mean, I think there's a lot of people that erroneously believe that if you are living with a serious mental illness, schizophrenia, bipolar, major depression, a personality disorder, that is a life sentence to an unhappy life, and in and out of hospitals, and in and out of homelessness, and unable to work or finish a degree. And none of this is true. all the evidence shows that when you provide housing and wraparound services and the right medications and the right supports and help people get reconnected to family and friends and community, they don't stay long-term thresholds members. Now, while some people may be with us for a very long time and we want to be there with people to support them for as long as they need us, when you can do all of this stuff and people leave threshold services because they can maintain a life and a job in a community where they will thrive, I mean, that is the biggest success. So, and I always tell people that mental illness is an equal opportunity offender, if that's the right word. It does not matter your color, your creed, your income status. These are serious brain challenges, and everyone, unfortunately, is susceptible to them. So I always tell people that we're all one degree of separation from a mental health challenge or a substance use challenge. It's not about somebody else. This could be about us, and this could be about, and is often about the people closest to us, people in our families, our friends, our neighbors. You might have known this already, but I lost a younger brother at age 29 to serious mental illness and alcohol addiction. And, I have very few regrets in life. And one regret is that I was not able to help Eric find Thresholds or find a place like Thresholds that could have saved his life. But, that was 25 years ago now. And the systems were really not set up to appropriately serve people with dual diagnoses. And you probably know this very well. The systems have been bifurcated or trifurcated. And, not only is the head not seen for a long time as part of the body, and so mental health,
Right.
substance abuse were treated as the other. When people were suffering from both challenges, it was really hard to find a place to serve them. And that happened to be my brother's challenge. So I wake up every morning thinking, what can we do to make sure that people can get into our doors and our partners' doors, regardless of their dual diagnosis, and meeting people where they are at, to meet them exactly squarely where they are at in their journey. And that's where we begin.
Yeah, as you well know, stigma attaches to so much of this. Has that diminished in the last handful of years, in your view, in your experience?
I think that, yes, stigma, it's still out there and it's still challenged. And you hear people use words all the time that we don't want people to use. I don't even want to repeat them on a podcast, but, he's crazy. She's out of her mind. That,
Oh,
all the negative language that people can use, and people that are really sophisticated and educated and kind, have used this language. So I think part of the challenge is that there's just been a long history of using language that stigmatizes and diminishes people, and that's harmful. And I do have to say that over the last decade that we've made enormous strides, and there's been so many organizations that have worked so hard, from the Kennedy Forum, founded by Patrick Kennedy, to the National Council for Mental Well-Being, to artists and teachers, and mostly people with lived experience of mental health and substance abuse challenges, that have come out and said, this is who I am. It doesn't define me. The illness doesn't define me. I'm a person living with schizophrenia. I'm not a schizophrenic. I'm a woman living with bipolar, but I am not bipolar. So I think having people tell their story and speak out has been really tremendous in helping us fight the stigma and discrimination. I think the
yeah.
bigger challenge we face is discrimination and stigma. And finally, I just want to say that young people today give me so much hope, because young people, Gen Z and the Generation Alpha, I think it might be called, the younger people, they're speaking up, and they're telling their truth, and they're telling their stories, and they're demanding of older folks like me at 62, that we listen to them, and that we just don't hear them, but we actually listen. So I'm very encouraged by the younger generation dealing with mental health challenges up front and out loud.
Yeah, I was going to ask you, so we don't make this all gloom and doom, what gives you
Oh,
hope?
no.
So yet again, you're out in front and anticipating what I wanted to ask you. So what you're saying is that this younger cohort that's coming up is a little bit more forthright about these issues than previous generations.
Okay.
What would you say that is?
Yeah, it's a good question. I don't know what the answer to that is. I think maybe, because they've had access to social media, uh, for better or for worse, because I know there's a whole lot of challenges with all these phones and people living their lives through these gadgets. But I also think that there's more talk and there's more conversation and there's certainly more apps. And there's just more discussion about this. And I think as stigma has decreased, while I think discrimination still exists and is pervasive, I think the lessening of discrimination provided a lessening of stigma, excuse me, has provided an opening for younger people to talk about this. And I think younger people talking about it and just being honest has helped dissipate some of the longstanding stigma that we've
Yeah, that's really interesting. Last podcast I did with Mike Dennis was focused on M health. And when I think of M health, like a lot of people, when they think of M health, they think of certain Better Help and Calm and some of these other
right.
mindfulness meditation kind of apps, behavioral health apps, platforms. And he reframed it and talked about it in a very interesting way, talking about music streaming apps to get people over craving. So you fire up whatever that app is, and in that context, it becomes an M Health app. And you're talking about meeting people where they are. And he's obviously talking about using these apps, meeting people where they are. And tapping into already behaviors, already reaching for those apps, reaching for those things. So why not, in the flow of that, give them what they're already accustomed to, but turn
Mhm.
it into a positive, reroute some of those cravings to more positive activities. That's kind of an interesting thought process, an interesting way of thinking, and it seems to me quite an encouraging development.
Well, yeah, I'm hopeful that these apps that are springing up as we speak, and probably three more will be developed and put on the phones today. But I'm hoping that the researchers, people like a guy named Dror Ben-Zev, who's out of the University of Washington, used to be at Dartmouth and did a short stint at Thresholds, and is an M Health expert. I just really hope that these tools are clearly evidence based, that they have scientific rigor behind them before they're put on an app for use. I don't want to be a Luddite here because I'm on my phone all the time and I'm using these apps and I'm using Chat GPT. But the limitations of it. In Illinois, for example, there was a law passed this year, signed by the governor, to prohibit the use of like chatbots only in mental health and therapeutic and counseling engagements, right? Not prohibiting them, but really, limiting their use as the alternative to a therapist or a counselor or a psychiatrist or a psychologist. So I think one of the things we're going to really have to grapple with even more so is how we're going to be using this new technology and AI in particular. Because I use AI every day for something. I'm asking
Sure.
GPT to help me do something or make the thing I'm writing clearer or research that I'm doing for a speech that I'm going to give. But we also want to be really careful here because there's, garbage in, garbage out. I also read a study last week that was really frightening. The number of people that engage daily with ChatGPT that the company has determined are actively, however they do it, actively in a suicidal state or suicidal ideation state, or are clearly experiencing schizophrenia or voices or hearing voices by the hundreds of thousands. And, so what does this mean? And of course, the people who are developing relationships with their chatbot, like feeling some kind of heart connection to something that doesn't exist by the hundreds of thousands. So this is not easy. And we're going to have to be so mindful, not to use the Buddhist meditation term here, but I also believe in that. We have to really be mindful as we're using this technology to help us solve really big challenges.
We perhaps already touched on some of these things, but is there anything that people are not talking enough about?
Wow, that's such an interesting question. So what maybe people are talking about this a lot right now, but this is what is keeping me up at night. And I wish more people were talking about it, that there are serious threats to the healthcare financing and funding and health delivery system as we speak. Threshold serves almost exclusively people on Medicaid, people who are disabled and on quote unquote old Medicaid, and then thousands who are part of Medicaid expansion. Not to mention people with private insurance that may be buying it through the insurance exchange, the ACA marketplace. And healthcare financing is under attack, at least the public financing, as you know. And everybody needs to be talking about this, because if we do not solve this Medicaid funding crisis, the challenges we have today are going to be so much worse in a year and so much worse in 5 and 10 years. And I can't even state that enough. So everybody needs to be talking about this. The homeless crisis in America and in our big cities is also a huge challenge. And we're getting a lot of, I don't want to say mixed messages, we're just getting direct messages from Washington, D.C., that the housing, permanent supportive housing that we and thousands of our partners provide around the country, and harm reduction housing, again, meaning meeting people where they are at and not kicking people out of housing because they are using drugs, or kicking them out because of behaviors that are challenging, but with work can be addressed. This is under attack. And as we speak, I don't know when this podcast is airing, but SNAP benefits, food stamp benefits have been cut off for millions of people, as of today. So we're all scrambling to figure out how we're going to feed our collective clients. So maybe that's not the answer that you're looking for, but I think everybody in this country needs to be talking about the attacks on the healthcare system, and frankly, the challenges of continuing to be able to provide as big organizations and small organizations, private health insurance for our employees. The rates are going up astronomically, well above the pace of inflation. And, this is a major challenge for organizations that are trying to basically do more with less.
Some of what you're saying goes to a previous question I asked when I asked you, what are some of the things that people come to you with who are perhaps outside this space, where you have to disabuse them of some of these misconceptions, these notions, these myths. And part of the mission of this podcast, in a more general sense, is to bring some of these issues, because, we're talking to research scientists and implementation scientists, people who are doing the work. But we want to get outside. I wouldn't necessarily want to call it a bubble, but outside of the space, so it becomes a little bit more intelligible. And it resonates with people who don't understand, for instance, that Medicaid, because I think people have a very narrow view of the population, the sliver of the population that Medicaid affects. They don't realize how broad it is, how it reaches into rural communities. There are just a lot of misconceptions and notions out there that require some sunlight.
Yeah. Well, and like the misconception that people who are on Medicaid are not working or don't want to work.
Right?
Hence the work
Exactly.
requirements that are going into effect next year. This is such a huge challenge because, everybody that we serve at Thresholds on old Medicaid or new Medicaid wants to work, and a lot of them do, in fact. So the idea that people who are on Medicaid don't work or don't want to work, that's just, I can't think of a better word. It's just a lie. It's just not,
Right. Not true.
So I think, this also gets back to another huge challenge that I think we're facing as a country and facing as providers and facing as people who are, imbibing news or information, that like, how do you figure out what is true and what's not true? Everybody is struggling with this because of, purposeful misinformation or obfuscation. And to get back to the Medicaid work requirements, for example, this has been tried over the decades and it doesn't work. And places that have done it thought that they were going to save money and get people back to work. And in Georgia and other places where they've experimented with this, it just doesn't work. So, I think what's important is like how we figure out how we sustain Medicaid, how to make it work, how to provide the right rates and rules and regulations so that we can both take care of the people that desperately need this until they can hopefully find a job that has good, decent health insurance that their company can pay for. And Yeah, and we just
Yeah.
need to keep telling the truth about, these major policy changes that we're facing that are driven by ideology and not necessarily by science. And that is my biggest fear, Charles, at the particular moment, is that science and evidence, which is so important to everything I've worked on in my whole life, everything that I've done from international aid in Africa to HIV and AIDS, we have I've spent 40 years collecting the data to show what works and using evidence-based programs, and not frittering away money that could be spent on something that works and has the outcomes we want to achieve.
You used purposeful misinformation. I'm going to have to incorporate that. I think that's very much what's going on here. Anyway, so that sort of slams the lid on the gloom and doom portion of this
Right,
conversation.
right.
Now we're going to get more positive, and I hope you appreciate how I stage managed this conversation. So now we're going to talk about leading with love. You know what? I'm just, we're recording. Now you can freestyle. I'm not even going to ask you a question. You can just go off for the next 3, 5 minutes.
Oh no,
What
I'm not
is
good.
leading? What is leading with love?
Okay, so I'm not going to talk at the poor audience for 3 or 5 minutes. So once I get started, I'm like a
Well,
steam.
I'll chime in when
Yeah,
needed.
please. But so this actually stems from a talk that I gave about 8 years ago. Now I was asked or encouraged to consider doing a TED-like talk at our trade association, the big trade association, National Council for Mental Well-being, based out of Washington D.C. And I wanted to do something about leadership and organizational development and what was important to me as a leader and the values that drive me. And I started actually writing the speech in November of 2016 when there was a certain election in the United States that put us on a different path and the path that we are on. So I started writing this speech in mid-November of 2016, and I struggled, to try to figure out sort of what was going to be the glue that held this all together. And then I had this aha moment about how I was both going to get through the political environmental challenge, if you will, and lead thresholds, through what was going to be potentially a very scary time. And and then I just woke up one morning and it was so clear to me that it is, for me, it's about leading with love and leading with empathy and compassion and courage, of course, and smarts and evidence and all of this stuff. But like what was important to me as a leader and how I connected with my colleagues and how I connected with our clients or how they actually connected with their clients. And what was the overarching value? Because all of our organizations have our values and they're posted on the walls of what they are: efficiency and effectiveness and honesty and all transparency, all these good things, which I totally believe in, and love. So it was really fun. And then I started doing research and looking at all of these authors and scientists and doctors who had written about it and studied about it. And it's just, and the evidence is so overwhelming. And it doesn't matter if you work for a nonprofit or if it's in banking or if it's in pharma. There was this landmark study done by two amazing academics that looked at this question of leading with love, and they just found that the evidence was overwhelming, that it improved employee morale, it improved employee retention, it improved client outcomes, most importantly, and it led the organization to success. And so I started writing this speech, and then I gave my 18-minute TED talk at a conference, and then people all over the country have been asking me to go all over the country to talk about leading with love, from
Wow.
corporate bankers to I went to the University of Michigan last year and did it for the entire pathology department, and in North Carolina at an addiction conference a couple of years ago. And that, I never thought a speech from 8 years ago would have such legs. But what a final thing I want to say about this is that it's so important is that I didn't bring love to thresholds. I mean, as I said at the beginning of this podcast, I was so loved as a kid. My grandmother, I was raised by parents, and my grandmother showered me with, presents and ice cream and all that good stuff, but mostly with just love. And it just sort of set me on this path my entire life. And really, when I got to thresholds, I made a decision that I was going to lead explicitly with this, that I was going to tell people as often as possible, even in the most difficult circumstances that I love them. Um, I love them for who they are, and I love them for what they do. And I want to be the biggest support to you possible so that you can be the best that you can possibly be. And, I don't know if it's causal or what's that? Let's see. If it's not causal, it's not coincidental, it's correlative, right? I
Correlative.
don't know if there's a causal or correlation here, but Thresholds has just grown dramatically. We've won 10 Best Workplace Awards, I think 10 years in a row from Best and Brightest.
Yeah, it's impressive.
And the Chicago Tribune is going to announce any day now their top workplaces in Chicago. And what's today, the 4th? I think we're going to know on Friday if we were named for the 10th or 11th year in a row. Employee satisfaction is at an all-time high, and client outcomes are really, in general, fantastic. I mean, there's so much work we have to do because I want to go from great to greater and greatest, but it 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 seems to work. And if and some people say, oh well, love shouldn't be a strategy. Love should just be the thing. But hate is a strategy, and meanness is a strategy, and misinformation is a strategy. So if love is a strategy and it works, I just think more people should at least try it. So there's my story about leading with love.
No. That's really good. My question is, some people may actually embrace and intellectually understand the so-called argument. Just like some people are incapable of expressing love, outside of a workplace context, traditional love, how that manifests itself and so on and so forth. And I'm sure there are executives who are very much like that. Mark, I like this concept, but I feel uncomfortable. I'm not really capable of expressing that freely in my private life, in my business life. What would you say to those people? Is there another way of saying love? Is there
Yeah,
another way of framing that?
yeah, that's such a great point. Yeah, love makes a lot of people uncomfortable. I don't get it. You can say love at the house. You could say love at your church. You can talk about love in your temple and at the mosque. And every song is about love, right? I mean, doesn't Taylor Swift mention the word love in just about every? I mean, really? I mean, so everybody can say love and talk about love in music, in movies, at church, and at home. But for some reason, taking this concept of love to the workplace feels anathema to people. And I just think that's sort of a paradigm that we as leaders have to shift. But you also don't have to use the word love. I love love. And I could not write a speech called Leading with Empathy or Leading with Compassion because I also love alliteration. So
Right,
leading with
right,
love
right.
has a melody for me. But if kindness or compassion or openness, or I don't even know I've never looked up all the synonyms for love. You should. I mean, use the word that works for you. And if it's not love, there's no requirement to do it. But but it does feel to me like, the golden rule, which nobody seems to really be opposed to, about like do unto others as you would like others to do unto you. you know, and uh, and if kindness is the word, then I would say then lead with kindness. But it doesn't
Whatever works.
mean for 1 second that you do not lead with strength and with directness and with transparency and with honesty and have very tough conversations, and even, of course, have to move people out of your organization at times when it's not the right fit. Folks are not doing the work that needs to get done. And love does not mean that you sugarcoat the reality or pretend that things don't need to change or that actions don't need to be taken. But
Yeah, I wonder.
you can do all this with love and kindness and compassion.
Yeah, I wonder if, again, not to make it a semantics thing, but if you approach somebody who, for some reason, recoils when they hear this word love, maybe just be human.
Be human. That's even better. That's right. Right.
Be a human being.
Be a human being. Yeah. unfortunately, there are a lot of human beings right now that are not leading with humanity and leading with kindness or compassion or love.
Yeah,
That's the challenge we face. And
for
that's,
me, that's high praise. When I say somebody is a human being, to me, that's high praise. In Yiddish, mensch, it's the
mm,
highest praise. What does that translate to? Just man,
yeah, I
you
love
know,
that. Oh God, I love that word.
you know,
I use the word mensch almost every day. If I don't
it,
tell my husband he's a mensch, I think it and he knows I'm thinking it. So,
he knows you're thinking it.
yeah.
Now, would it be corny to say that I loved having this conversation with you, Mark?
Oh no, I'm hoping that you would say that. Yeah.
No, I really, really enjoyed this. Your team raised my expectations and you pretty easily cleared them. So I really do appreciate this conversation and all the remarkable work you and your entire Thresholds team is doing. Keep it up and good luck with this award. I know you're waiting with bated breath. What do you
I
say, the
am.
last
My
10
fingers
years?
and
Last
my
10
no, I
years?
think if we win this Friday, I think it will be oh God, I should know this. I'm so bad at numbers that it should be it's either the 10th or 11th time in a row that we will be a Tribune top workplace. Last year we came in at number 6, which was I mean, just think how many companies there are in Chicago.
For sure.
To come in at number 6, I mean, and just to make the list. So, I'm crossing my fingers. It's been a rough year, but all of these awards are based on employee feedback. So,
It's authentic.
we'll
It's,
know on
yeah.
Friday if my beloved employees said yes, this is a top workplace. My gut is feeling good that
You,
we're in a good place. We're a place filled with love and
Because yeah,
so.
you don't want to get a bad result and then have to all of a sudden lead with spite. That would not
Oh,
be a good message.
I'm not doing it. No, never. No, there's too much love to give and too much love to receive, So the final thing I'll say, I'll quote another musician, which I'm sure is in your pantheon, though that's a lot of assumption on my part. But these two guys said that in the end, the love you take is equal to the love you make. So
Yes. Yes, indeed.
make love
Indeed.
and it'll come back to you in spades.
Indeed. Well, Mark, again, thanks so much for taking the time. This is a wonderful
Awesome.
conversation.
Great to meet you, Charles. What a pleasure. And what a mensch. What a mensch you are.
Why, thank you.
That's what I
Why,
say. More mensch, less Michigas. Right?
very nicely done. And again, goes to your thing, your alliteration thing. So very nicely done. Very nicely done. You brought it all together.
Okay.
Today, I spoke with Mark Ishaug, President and CEO of Thresholds. Thresholds provides healthcare, housing, and hope for thousands of persons with mental health and substance use conditions in Illinois each year. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.